Happy Saturday night, everybody. We've got another special episode for you. Tonight is a blind react. Do you see what I did there? In tonight's video, I have no idea what's coming. I have a slight idea that we're gonna be looking at potentially a blinding injury, a blunt force injury, but I don't know what's coming. I'll react to the video and give you some information on the injury, and we'll talk about what could have happened and what might be in store for the patient going forward. Welcome to Salisbury Eye Care and Eyewear. I'm Dr. D. My goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every Wednesday at 8 p.m.
to happen as a result?
Like, long story short,
I was British.
It was just in a little champagne party where they popped loads of bottles of champagne.
Oh, I love the British.
Yeah, holiday in Ibiza, yeah.
I have a terrible accent.
These are going off right, left and centre, aren't
Yeah, 100 bottles. So
100 bottles?
They give out the bottles and stuff. I'm always a bit wary of them anyways. I'm like,
100 bottles of champagne on the wall. 100 bottles of champagne on the wall.
So I have my glasses on. I walk through, but I leave my glasses on. And somehow, someone popped a bottle of champagne spray.
Champagne spray party.
Underneath my glasses in my eye.
Love it.
So briefly, you know what I mean? I take off my glasses, go to wipe my eye, turn around, split second later. I go to shaking the bottle, so she didn't even pop it on purpose. Lifted up my glasses, and I'm very tall. I mean, I'm 6'5", 6'6". She just held it down here.
It was right underneath.
Oh,
Yeah,
no.
and it was an absolutely amazing shot from her. She was aiming for my eye. You know what I mean? If she was aiming, then absolutely a banging shot. So I turned around, clean, I was like this,
Banging
opened it,
shot.
hit the eye. And,
Literally.
Oh, it was a bit of a bad pain. Yeah, it was a bad pain.
How bad? Did you realise how bad it was
It's a very
at that
eerie
point?
pain because when it's your eye, and you just know, just like common sense, if a cork hits you in the eye, it's never a good thing. And I was just like, nah. So I couldn't open either eye at first. Had my hand over, I couldn't see anything at all. Stumbling, like someone grabbed my arm, pulled me to the side, and I was just on the side, just like, no, this hasn't just happened.
Was it bleeding?
I waited 2 minutes, just like hoping the worst case scenario hasn't happened. So I looked down and there was just blood in my hand. I was like, no way, I can't believe she got me. So yeah, from there, the security grabbed me, they chucked me to the medical room, and the medic looked at it. I didn't know if there was glass in there or anything like that. And you know, in the Spanish, she didn't really talk that much English.
Does he still wear that eye patch?
I had to wait 10 minutes.
Is that like his thing?
Pull my eye open. She goes,
Can we find him?
Oh my God, let's get this boy to the hospital now. I was like,
Oh, poor guy.
At this point?
yeah,
Did it worse?
do you know, say you get hit by anything, it hurts for 5-10 minutes and the pain eases up. It was like constant pain for the first 2 days. Didn't ease up even that. So I went to the hospital even after the surgery. I went to theatre straight away.
What did they do?
I mean, surgery, when you say, I mean, actually your eyeball,
Yeah.
you're going to lose it.
At first, we thought that, because luckily Ibiza, thank God to them, they got a one eye surgeon on the island, so he comes in his shorts, Converse. I looked at him, I was like, all right, at least he's there. He looks at it, he goes, all right, straight into theatre. But at first it was the worst, because I go, doctor, am I going to see again? I was quite upset. And he goes, don't worry about seeing again. We tried to save the eyeball. And I was like, what do you mean save my eyeball? It's one thing cutting it open, another thing maybe having your eye removed. So I ring my girlfriend Kaz. I was like, oh my God, they're gonna take my eye out.
So
like,
Kaz wasn't there with you at this point?
No. I was with my friend. She flew out. She goes, she's on the flight. I was like, there's no need. Took me to theatre.
We should say to people, this is, we're only talking about 10 or 11 days ago that this happened.
Yeah, about 11 days ago, I think. But that was the worst, like thinking like having a good holiday, and then next thing you know, you're in hospital saying you might have to have your eye removed. But luckily, like it wasn't
a real buzzkill,
too damaged and needed to be scooped out. So I woke up 4 hours later. But as he was telling me, no one spoke English, so I was like, don't take my eye out.
But your eyeball was split. I mean, they actually had to stitch it together again. The sound.
Yeah, it was. You know, you got your eyeball. It didn't go, the retina, apparently is the main part of your eye, was swelled up and it was bruised, but that part didn't split, which is apparently the main part of seeing. I don't know how your eye works that well.
The front of your eyeball.
Yeah, and it didn't go through the pupil, so it kind of went from the white part through the iris to the other white part, so I got 7 stitches through my eye now. But he saved it, so I woke up and I was like, am I going to have to see again? He goes, you'll never be able to see the same again. It might be a very long time till you start seeing anything, like even in a blurry wise. But if I look now, I can see light, that's a good part. But like I explained, like looking through like a stained glass window. So you can see, I can see, but everything's just a blur, a massive blur. So if I shut this eye.
Okay. Well, I have a lot of thoughts. So first of all, I had no idea what I was about to see. And so the English accent right away got me. I love an English accent. And I love so they are on holiday. He was on holiday, I think. It sounds like with his girlfriend. First of all, I'm so jealous of all the holidays. I know it's pandemic, so nobody's going on holiday right now. But just funny story. My husband and I were on our honeymoon in Jamaica, and we met all of these folks from British folks that were on holiday. And we always joke that they are the best vacationers. They're so good at vacationing because of the holidays. I'm super jealous. I'm saying that in a good way. You guys are pro vacationers, and this is no different. What a champagne spray party with 100 bottles? I've never been to one of those, but that sounds amazing. So yeah, first of all, cool situation. I want to go to a champagne spray party. But yeah, so what happened to him, he had a blunt force injury to that eye. And that champagne cork, I'm blind reacting to this, no pun intended, now that I know. But they're going to travel a very high velocity, a very high rate. And something with a projectile with that much speed is going to really cause a lot of damage to the eye, obviously. So what happens in the eye is that the eye's got incompressible fluid in it, and a blunt force injury like that is going to cause that fluid to shift and all of that force to be transferred. And then the eye has a very high probability of rupturing or causing what we call an open globe. And it'll happen at the weakest point of the eye, which is not always exactly where that projectile hit. Sometimes you can have the projectile hit in the front of the eye, and then the actual rupture of the globe is further back because there's some weaker points where the muscles insert. And so I don't know if he had an open globe. I was kind of trying to listen. At the end, he talks about how it sort of grazed across his eye potentially. He talked about iris damage. He talked about corneal damage and 7 stitches. I think he still has his eye at this point, but his vision is really, really bad. That's not super surprising to me. If there was iris involvement, that definitely always complicates things. A blunt force injury like this, it sounds like he could have had an open globe in terms of at the cornea. If there were 7 stitches, it sounds like that's potentially where the open globe was. And one thing that's very concerning is if the iris actually ends up protruding through the wound and becoming exposed to the outside air. Anytime you have a blunt force injury, open globe is a huge concern. I've seen one of my patients a few years back had a bullwhip kind of come back and hit him in the eye, and he had a hyphema, which is blood in the anterior segment of the eye, in the anterior chamber. So literally, if you looked at somebody with a hyphema, they would have blood at the bottom where their iris and their cornea meet. So hyphemas are really common. You can have an orbital fracture. So a lot of times in injuries like this, now a champagne cork is smaller, so it was able to actually sort of breach the orbit and do actual direct eye damage. But let's say you had a baseball hit. I've seen this with a baseball, an outfield or something, bad catch, it gets hit, or a foul ball. If it hits you just right, you can have a fracture of your orbit. And most commonly that's going to fracture the floor of the orbit just because that's the weakest point. You can also have just closed globe injuries. So there's coup and counter coup injuries where all that force causes problems with the retina. Commotio retinae is one of those big ones where the whole retina becomes kind of white from that force and counter force that happens. So ultimately, this is a devastating injury, and his eye has been through a lot. It sounds like kept his eye for the time being, has really limited vision. Thankfully, they didn't have to enucleate in his case. Going forward, one thing that's really not all that common, but can happen after an injury like this, especially if that iris was exposed to the outside air and sort of protruded through the wound, is something called sympathetic ophthalmia. So there is actually a condition where if you've had a really traumatic injury in one eye, later on down the road, you get this like immune sort of overstimulation, and you end up having inflammation, potentially high pressure, and both eyes can be affected. And it's a very serious complication of an ocular injury. And in those cases, many times they will enucleate that initial eye to kind of stop the stimulus for the sympathetic ophthalmia. Super rare. If you've had a blunt force trauma to your eye, comment down below if you've had a hyphema or an open globe, and I'd love to start a conversation with how that went for you, or even if you had sympathetic ophthalmia. Like I said, that's super rare, but it does happen. This video is awesome to watch, really educational, and it shows why it's so important. Eye protection is so important. So, you know, I talk to my patients all the time about how glasses can kind of be that extra barrier. And in this video, you see, you know, the 1 minute he took his glasses off, that champagne cork got him. So protect your eyes out there, especially if you love to work in the yard. If you are a weekend warrior, that's when a lot of these things will happen. And keep those eyes safe with safety glasses or polycarbonate Trivex type of lenses in your glasses. Thanks as always for watching. This is our new Saturday series, so make sure to like and subscribe so you can see every video, and we'll see you next time.